How do you help educate patients on their condition?
Well, I think we just start from the very first visit and start talking about what the diagnosis is, what that means, um, what they might expect in the future. I think over time, as you said, some of our families really do become experts, particularly if they have something that's complicated. And they'll say to us quite often, when I'm home or I have to go to the hospital near where I live or I see my doctors there, they don't know anything about this. And so they become the teacher, essentially, teaching their physicians or other healthcare providers about the diagnosis and what it means. Sometimes that's tough on them, I think, because they have to advocate for their child and they also, or themselves, and they also have to be pretty insistent about what should and shouldn't be done. Um, they'll get to the point where they'll say, that doesn't need to be done, we don't need that test, this is something that's happened to my child before, this is what we did the last time. So they become the teachers essentially where they live.
No, another point that I would say I think is helpful for people too is also to teach them, especially if they're coming in with a diagnosis that we don't agree with or we don't think the terminology is correct, explaining to them why we don't think the terminology is correct, I think is really helpful. Couple turn on a Weber, for example, is one that we hear, and we try to explain to them why we don't use the word Weber and kind of where that whole kind of origin came from, or why hemangioma isn't kind of just a blanket diagnosis, and really what hemangioma means by our center, that's a diagnosis you see more in early childhood. So I think those are kind of examples of what I meant. So I think that's really important for families, and also again, kind of for like down the road with teaching, just for them to really be able to recognize the patterns of their symptoms, really understanding what the difference is between, say, infection, for example, for them versus maybe just an irritation or an inflammation. Again, I think they really become advocates in the sense that they can say, well, not every fever for me is an infection. My team has taught me, I have to look at these signs as well. Or, that's really hard, I think, sometimes for local physicians that they see, there's redness and there's a fever. You automatically put a patient on antibiotics when they learn their patterns down the road. That may not always be the case and may not be the best care. So, again, kind of meeting some resistance in the kind of more commonality of kind of medicine, that they have to kind of really advocate strongly, I think, for themselves in that part.